Hello, everybody. Welcome, 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 welcome. Happy to have you all here. I can see a number of people joining already. YouTube, Facebook, you're all welcome. Again, like you've seen in the comment section, let's know your name and where you're joining us from. Oh, great. We have Bukata from Bauchi State again. Amazing. We have Gloria from Ibadan. Amazing, amazing. You're all welcome. Gospel. Let me bring you up on stage. Come up, come up, come up.
Hello, everybody. Welcome.
Welcome, welcome. That welcome is a long one. Who is new on this quiz today? We want to know you. If you're new, if it's your first time, let's know, and let's welcome you specially. You guys should not forget to share with your friends, okay? Share with your friends, share with your friends, share with your friends. And let's get started in the next 2 to 3 minutes. We'll be starting. All right. Get started soon. So share with your friends. Let's know where you're joining us from. Welcome again, Gloria from Ibadan. We're happy to have you. Thank you. All right. Share with your friends. We'll be back in a minute. All right. Welcome once again. We have Blossom from Abeokuta representing the entire Ogun State. Yeah, you are welcome, Blossom. Blossom, Blossom. I love that name. The nurse influencer. So your real name is Gloria. I've always just known because we've always known her as the nurse influencer. Yeah. And Bukata from Bauchi State. Happy to have you join us. So for everyone joining us, don't forget to put your name and your where you're joining us from in the comment section. If it's your first time here, let's know you, let's meet you, and let's have fun together learning as well. All right, we'll be starting in the next 1 minute, and we're going to just do an introductory, just to introduce to you how the quiz runs. All right. First of all, I'm going to show you a demo question now. So the way it runs is this. Um, you're going to see a question showing on your screen, which I will do a rundown with you just in a minute. And once you see that question running, Gospel is going to read it out to everybody. And once he's done reading it out, I'm going to put up a 60 seconds timer. And that timer will run for the next 60 seconds. Once the timer is off for the next 60 seconds, um, after the 60 seconds is over, then you will, your time is elapsed. Sorry, I had a breaking thought there. So the time is over at that point, and then we'll be reading through the comments to see who got the right answer. I will pop up the right answer, and then we'll see who's got it right. For those of you who are not who have been here before, you know how we do it already. And this is just for everybody who have not been joining us before. Again, welcome Esther Oyedokun. Yes, influencer. Yeah, it's happy to know. I'm happy to meet you finally and properly. Yeah. All right. It's a good time to still say that you should subscribe to the channel. Please do that. Please subscribe. Please subscribe. Okay. And let's get started in a second. Just give me a minute. All right. I'm going to do that test run just now, okay? And we'll be starting fully once I believe everybody gets the way it works. So that no one is saying, I don't know how it works, so I never knew it's this way or that way. All right. So this is the demo question. Demo question is running. Gospel, where are you?
Yeah, I'm here.
Okay, okay, good.
So I was
So the demo question is up.
meant to read the question, and
Yeah.
then once I've read the question,
Can you see the question?
yes, I can.
So can you read it out? So we just want to do a rundown of how it is
All right.
normally.
A patient undergoing chemotherapy is experiencing severe nausea. The nurse administers dash to alleviate the nausea.
So I'm going to put a 60 seconds time now, and as the time goes, you're expected to provide the answer within this 60 seconds. So, and once the 60 seconds is over, we see you're going to find, all right, the answer showing on the screen, and we are going to go through the comment sections of all the platforms we are on. We have a centralized system seeing we're able to see all the comments you are putting in. So whether you put it in on Facebook or on YouTube or wherever, you are going to see your answer. Now, who gets the prize is whoever drops the correct answer, the most correct answer at the earliest possible time. So if you are the first person to drop the most correct answer, then you will be getting the prize. And it's a token of 1,000 naira. Okay, so now that's it. The time is over. Oh my god, sorry. I have looked it. So it should be 60 seconds. Don't be surprised. Not, not 2 minutes. Yeah. So 60 seconds, and that's the time over. So I'm going to just flash to you the answer. This is the answer. Okay, and that's how we keep rolling. I believe everyone on this live call right now understands the process. So I think it's a good time to start. If you are happy for us to start, put it in the comment section. Let's begin. Let's begin. Let's begin. Let's know who is ready. Oh, the nurse influencer say I know you. Interesting. Interesting. Maybe I do. Okay, welcome, Elizabeth Omolola Ajayi. Happy to have you here from Facebook. Nice, nice. Let's begin. Thank you. Who is ready to begin again? Just one more person, and we are ready to go. We are ready to go. We are ready to go. Remember, we started a series last month. We started asking questions around wound care, and we stopped at number 20, right? Gospel. So
I
I think we
think
stopped.
so. I'm not really sure.
Yeah, I think we stopped at number 20, and we said we are going to do another 20 questions. We planned 25 for last month, but we were not unable to go as far as 25. However, this month, today, we hope to be able to run fast, hopefully. So again, remember the question goes up and the answer comes up after 60 seconds period where you will be able to put in your answer. Don't forget the answers are short and simple. Keep it straight and fast, and that will be all. It's time to begin. Okay, the first question goes up just now.
A patient asks why frequent turning and repositioning are necessary. How should the nurse explain the rationale for this preventive measure? Your time starts now.
Okay, your time has started. Let's see who is getting it. Let's see who is getting it. Just tell us the rationale for this preventive measure. That's basically what it's saying. So put in your answer quickly. Put in your answer quickly. 30 seconds down. Okay, okay, okay. Seeing some answers already. Seeing some answers already. Good, 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 good. Keep it coming, keep it coming, keep it coming, keep it coming. You've got less than 15 seconds already. Less than 15 seconds. Less than 15 seconds to go. Less than 15 seconds to go. Okay,
Exactly.
okay. That's us done. That's us done with the questions. And this is the answer in simple terms. Is to prevent ischemia. I believe we all know what ischemia is now. Because we do want to. Do you think we should explain now?
Nope.
Well, so that's it. Who got it? Who got it right?
I don't think anyone did.
No one gave us ischemia as an answer, but someone did say something
Mhm.
like to for effective tissue perfusion, which is which is correct, right?
So
Which is correct.
was
Someone else said
close. Yeah.
effective blood flow, yeah, and someone else explained that the procedure is for comfort and relieving pain. It's for comfort and relieving pain, and last is to prevent pressure sore. Well, the most correct answer is still the first one to come. What do you think, Gospel? Since
Yeah, I think
we
so too.
nobody gave us the actual answer, but effective tissue perfusion is still in the line. Effective tissue perfusion will eventually prevent ischemia, but the end goal is that ischemia is prevented. Anyway,
Mhm.
um, Elizabeth, like we mentioned, we don't need to type long. Just look for one word, two words, three words that will explain your reason and put it your answer and put it there, so that you don't have to type too long and miss the opportunity of winning a prize. So for this first one, um, close to the answer, but we're going to give it to um, Blossom. We're going to give it to Blossom. Is that a good deal?
Yeah. I think so.
Concrete.
Congratulations, Blossom.
Yeah, congratulations.
Congratulations.
So I think we should go on to the next. Yeah, to the next question just now. So because we want to run and cover as many questions as possible. All right. Next question showing now.
When applying a topical agent for wound related pain management, where should the medication be primarily applied? Your time starts now.
When applying a topical agent for wound related pain management. Remember, it's topical. Where should the medication be primarily applied? Now, when we show the answer, I will mention something that a lot of us are quite uh, aware of. We can relate. I'm not going to answer that now. Let's
Mhm.
see. Let's see who is.
Less
Let's see who
than
is.
30 seconds.
Oh God, it's less than 30 seconds. So okay, the skin surface. Okay, I wish you can I wish you are more direct on this, but I'm not going to give you a clue to the answer. Oh, you said affected you. Oh, I'm saying the answers already. I'm not supposed to say the answer. Okay.
Four,
But,
three,
but,
2, 1.
oh, that's you. Now, this is the answer. The surrounding intact skin, right? And it has to be the surrounding intact skin. Emphasis on the intact skin. Because we remember that thing we used to do as children now, where they will go and put the this thing on the wound, and that is very, 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 very dangerous. Not
Yeah.
safe. So This is the correct answer. Just who got the answer right?
But I don't think anyone did because the first answer was skin surface, and skin surface can mean anything. It can mean the area that has the wound, and so I don't know. The other answers, affected areas. You have the muscles, the joints, the skin. So, to be fair, I don't think anybody got the um,
Answer right
answer.
as well. Unfortunately, we are going to pass on that because nobody got it right. So let's go to the next question. Again, look at it. The goal is that the the affected area is not going to be touched by any medication, except, I mean, I don't want to go deeper into all the teaching viability stuff, but basic thing is you don't apply any cream or any ointment on the wound surface, on the broken skin surface. If you have to apply anything, it has to be on the surrounding, because again, that's where there's inflammation. That's where
Yeah.
the processes of inflammation that is leading to the pain is actually happening. Okay. Well, let's go to the next question quickly so that we can cover much ground today and more people can win more more money. Let's go. Question 23.
Adjuvant analgesics such as antidepressants and anticonvulsants are used to manage dash dash pain by targeting abnormal nerve activity. The time has started.
I started. Yeah. So you have less than 50 seconds to go. Let me try and read it again. Adjuvant analgesics like antidepressants and anticonvulsants are used to manage dash pain. So pay attention to, we're just basically asking you what kind of pain do you use that kind of um that's this class of medications um to manage. And the clue is even there, go. He says that by target, so let's hope somebody gets the clue and gives us the answer. Oh, let's hope somebody gets it. There's a clue in the question already that tells you the kind of pain.
15 seconds more.
Oh, less than five, less than six, oh, five, oh, six, oh, okay, four, three, two, one, and that's us done. That's us. Okay, well, the answer is it's neuropathic.
Yeah,
Eh,
someone got it.
someone got it. Good, good, good,
Yep,
good, good, good. The nurse influencer on YouTube gave us the answer first.
yep, yep,
Um,
yep, yep, yep.
and luckily too, we have Adene Esse. I'm sorry if I murdered that name.
And then
But you also gave
S
us the correct answer. But that's on
SC.
essay, I guess. Essay. Yeah. I don't know. I don't know. I'm sorry. But you gave us something. You gave us the correct answer, but yours came in
Uh,
after the nurse influencer. Well, that's good. Good try from both of you, and from all of you
yep,
anyway. All right, from all of you. So again, when you see antidepressants given to some kind of patients, especially when they've had some kind of injuries and wounds, you are not surprised because yes, it can be used to treat neuropathic pain. Okay. Again, we always say it on this quiz is to stimulate you to study more. We're not
yep.
here to teach. We're here to just challenge you to study. So go look it up online, look it up everywhere. You find more information on that. Let's go to the next question. Question 24, showing right now.
What adverse effects is commonly associated with long-term use of NSAID?
Good. Your time starts now. What adverse effect is commonly associated with long-term use of NSAID? I believe you know what NSAIDs are. I believe you know
Yeah.
what adverse effects are. I believe you know. I believe you know. So let it come. Let it come. Don't stay too long. Someone else might put in the answer in your mind though. So be fast, be fast. Okay, okay, okay. We are getting answers. Good, 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 good. Good of you. Essay. Happy to um add your answers in here. Uh, Um, it seems like we're having a new crop of winners today. Some
I
new
guess
people that
so as
come
well.
in. Yeah, we are seeing some people, new people coming up and showing up. We're happy to have you all. Good, good. So, and that's it. So, I'm going to show you the answer just now. Now,
Oh.
it looks strange, right? Even myself, I feel like it's strange. But yeah, it's a possibility. But again, I know that I'm going to give it to people who said gastrointestinal, right? Gastrointestinal. What am I saying? Yeah, is it gas? Yeah, ulceration. Yeah, it's ulceration. But maybe I'm trying to remember what made me even put this answer as one of this as the answer. But I'm not really sure. I think it's just the fact that a lot of us will not know that this is also another chronic complication that presents. But yeah, I'm going to give it to somebody who says gastrointestinal ulceration. And maybe I'm going to make my research as well because I might have just done this compilation and forgotten why I put the question there. But yeah, it's common knowledge that GI bleeding is a, you know what I mean.
Yeah.
Yeah. Anyways, that's that for 24. Did anybody get it, gospel?
With what you said you're going to give it to those that said gastrointestinal symptoms, ulcers, and all that.
Yeah, I think we'll
So
give it.
if we are going by that, it's essay, adene essay.
Essay got it first, right?
Yeah.
Yeah, yeah, she got it first. So essay, and then congratulations, you got yourself another token of 1,000 naira for answering this question correctly. The nurse influencer is asking, did you get? Yeah, you got it right. I mean, our
Yeah, she did.
not blossom. Essay Adene is another name. Yeah, it's another
The
person.
nose influencer, she got the question correctly. I
Yeah,
think she was the one that won the prize now for that question.
yeah, she won the prize. Yeah, the nurse influencer won that. I mean, got that answer correctly, and she won that. Anyways, we are going to the next question. That's question 25 now. Now it's getting deeper and tougher, so pay attention. And as you read, pay attention, but don't forget that it's just one answer we want, not very long answers. Okay.
A patient presents to the emergency room with a swollen ankle following a sports injury. Which class of analgesic medication is most suitable for managing the acute pain associated with the injury? The time starts now.
Okay. So we are basically looking for analgesic, and we don't need you to particularly mention one. Just mention the class and pay attention to the pain, the type of pain. It's acute pain. So just to make it easier for somebody who is trying to grapple the long story that we have put in the question.
Uh-huh.
But we are trying to make it scenario based so that um, you can relate. I mean, clinically
Yeah,
understand. Okay, in this case, I mean, so let's hope somebody gets it right. Oh,
hopefully.
okay, okay. We are having some brilliant input from Facebook. Okay, 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 okay. Don't forget, we are talking about the class of analgesics. So, it's a class of analgesic words again. So, it's not just analgesics, right? Anyways,
Yeah.
the answer is clear and simple. Let me say it. Okay. So, let me say it. Gospel, do you have anybody get it right?
Yep. Essay again.
Essie got it right. Good of you. I'm proud of you. I want to know where you are from and which school you are from. Let's do that. Let's do that again. Let's
Ah,
do that gospel. We have somebody behind him today. All right. Yeah, NCS is the best, but a lot of you dropped your answer late. Essay,
yeah.
Essay Adene dropped it first, then followed by Bukata, both of them on Facebook. And the first person we had on YouTube is Nurse Influencer, which came third after them. But she said analgesic, which is actually not right. So the correct person and the the, the, the person who got it first is Adene Essay. All right. Thank you for that. We are going to go to the next question in the next second. Okay, next question showing now.
A patient with chronic lower back pain needs a pain relief. Which analgesic medication is commonly recommended for managing chronic pain conditions with minimal anti-inflammatory effects?
Your time starts
Now,
now. So again, let me help you so that because these long questions, these long scenario questions can be, but you need to pay attention to the keywords. From the start of the question, it says it's a chronic lower back pain. Okay, and we are looking for the analgesic medication, and then another key there is minimal anti-inflammatory effects. So in your mind, there should be you should be looking for that class of anti-inflammatory, sorry, class of analgesics that have minimal anti-inflammatory effects and can be and you think is safe for chronic pain. So just connect the dots and you get the answer. Connect the dots and you get the answer. Connect the dot and you get the answer. Oh my god, people have stuff here. Jesus is Lord. Gospel, are you seeing those very nice comments I'm seeing? Anyways, the answer is simple and straight, and this is the answer.
acetaminophen,
Yeah,
PCN,
acceptance, which is paracetamol. Um, by now,
enough
I think
inflammation.
everybody should know how it works. It has minimal anti-inflammatory effect. It has a stronger antipyretic effect
Yeah.
more than anti-inflammatory. But it's good for chronic management because they don't, you know, they they usually don't have severe side effects, except when you use overdose. You know, um, unlike the other unlike the other ones like ibuprofen and co that can have
Yeah.
comment who's got it right, who got it correct.
I
Yeah,
think
the
I
question is not
did not
straightforward.
influence.
Oh yeah, see the question again. This one is not straightforward. I love you. I love the challenge. Read it again. Chronic
The
lower
patient
back.
with chronic lower back pain needs a pain relief. Which
Yeah,
analgesic medication is commonly recommended for managing chronic
chronic
pain
pain
conditions?
condition,
But this pain medicine now is with minimal anti-inflammatory
anti-inflammatory
effect.
effects. So it's just testing your knowledge on analgesic. If you can read the WHO analgesic ladder, you will see
Yeah.
that they all have the specific use, yeah, and why they are used for specific purposes, and why it is safe for this and safe. Just read about chronic pain management, read alongside the use of paracetamol and all of that, and you will appreciate what we have put up there. Anyways, thank you for your input. If more questions to come in, so you have opportunity to win more. Anyways, but who got it right, Gospel?
The nurse influencer.
The nurse influencer said it straight up. Yeah, she said acetaminophen straight up. All right, and that's correct. Yeah, she said it. Someone said chimora.
Yeah.
I don't know. allopurinol, NSAIDs. That's not bad. I don't know about those. I just know. I'm not sure allopurinol is an NSAID. I don't know. I can just check
No.
that out. Okay, so the correct answer was given to us by the nurse influencer, and congratulations to you, nurse influencer, for that. Okay, let's go to the next question. 27.
A patient with diabetes presents with a burning, shooting pain in their feet that worsens at night. What type of pain is commonly associated with diabetes? The time
Oh,
starts now.
your time starts now. Yes. So don't forget, it's somehow entering pain management. Maybe next time we'll focus on pain management. But this question, the idea is actually from wounds that comes from diabetes and then now resulting in pain. So what type of pain is usually, oh good. Who is this? Let me not talk yet. Gospel, are you seeing what I'm seeing? Are you seeing what I'm seeing? Ah, ah. Remember diabetics or people living with diabetes. And remember that we are continuing it in relation to the wounds that they have. Time up. Okay, I think we have somebody with the answer, but let me just show the answer quickly. The answer is neuropathic pain.
Yep.
So linked with diabetes neuropathy. Very good. I think a lot of people understand the question and they got it right.
Yeah.
And again, we have, I don't know if it's a star girl or star boy. Is it a lady or a man? I don't know.
Who's that?
But she's giving us another very correct answer tonight. And congratulations to you, Essie, for that correct answer. Diabetes neuropathy. That's correct. Thank you very much. We got a lot of other people dropping something related. Good of
Yeah.
you all. Thank you for dropping that. Again, I think it's a good time to ask you to please like this stream. Please drop a comment. Well, you are dropping a comment already, but if you are still viewing and you're not dropping a comment, please do so just now. All right, and subscribe, follow whatever platform you are on, share with your friends. All right, and let's just grow the community together. Anyway, I have some plans that I will share with you all at the end of the stream of today's edition. So stay tuned, stay tuned. And for those of you that are winning a prize, don't forget that you can only redeem your prize with us. So stay tuned, stay tuned, stay tuned. Okay, let's go to the next question.
A patient sustains a burn injury while cooking and immediately seeks first aid. What is the recommended duration for cooling the burn with cool running water? Your time
Good.
starts now.
Okay, don't forget, think around wound care, think around, this is now tilting towards um burns injury now. Wound care in burns injury. So think along that line. Think along that line. How many minutes do you think the person should leave their hand under water, under cool running water? So this one, if you get it right, that will be very, very impressive. However, if you don't get it right, I will encourage you to go and double check what I have put as the answer, because I know it might seem like, oh, I don't believe, I don't agree. Anyway, just
Mhm.
check it out yourself and you probably see what I have done or what we have put together. Okay, and that's it. So let's show the answer. It's just 20 minutes. 20 minutes is the answer. Oh my god, someone got it right. Someone got it right. Gospel, who is that? Am I seeing? Am I seeing? Who is the first person? Okay. Did you see anybody? Well, okay. I think I'm.
No. Yeah, there is someone, the nurse influencer.
Oh, the nurse influencer got it first. 20 minutes. Then Elizabeth as well got 20 minutes. That's very brilliant. Nurse influencer, good of you. I think say we should give her 500 for and remove 10 minutes. That's good. That's good. Anyway, we'll consider that later, much later. Okay.
Then we have to give Bukata 500 as well now, because he said
You
10 minutes. We will
just
just add
imagine.
10 minutes to his own.
So we'll give everybody the prize, you know. So that will not work. So let's. But you are doing well already. I think your performance is really impressive. Very very impressive. I'm seeing that you people are sharing it. Very good. Thank you for sharing. So let's go to the next question so we can cover more ground today. Where are we now? We are going to number 29.
Yeah. A healthcare team is discussing pain management for a patient with a burn injury and another with a diabetic foot ulcer. In which case is the intensity of pain likely to be severe? Your time starts now.
Mm-hmm.
I think this is
This is
more straightforward.
it's not. You think it's not straightforward?
I think it is the most straightforward.
Okay, it's the most straightforward. Anyway,
Yeah.
yeah. It's just seeming tricky. I hope everybody gets the trick quickly. Yeah, there is one of the two that will have a severe intensity. So when you do that intensity pain rating scale, one of them will have the strongest. I think people should get it right. I'm sure we have brilliant people on this show tonight. Very brilliant guys. I mean, even the most unlikely question, people are getting it correctly. anyways, it seems like some people are sitting with the computer like every the very minute that the question goes up. ah,
All right.
oh God. And this pal of ours, this Charlie, I didn't I need to know where you are from. Drop where you are from in the comments, please. Where you are joining us from. Are you a student or a staff? Maybe she's one CNO like that we don't. Ah, like we had CNO one day. Anyway, this is the answer, and almost all of you got it right. So who are we giving this one on gospel?
The first person that got it right.
The first person.
Uh,
That person is again is this essay. She got it right. That's brilliant. Congratulations again.
Congratulations.
Anyways, if you saw the flyer today, you saw the person that will put. She always won. I don't know why she's not here today. What's her name again? Uluwabamire. So maybe
Yes.
Essie has come to challenge that, and the nurse influencer, get pumped up. Don't let anybody take your place. That's just a joke. You all are doing very well, and we're happy to have you. Oh, Bukata said you got it first. Now this is it.
Was he?
This is it. The timing matters. So even if you put it at the same time, the seconds differ. And the first person that is showing here, because we are seeing everything again. I know I can see that you have your correct answer as well. I mean that's it showing on the screen. But again, the first person to show, I mean, and which definitely means that your answer came in first is is Adene S. Okay. Anyway, we still have more questions. We still have very, very, very. So we have a long way to go. Bukata Ishaku, you are welcome again. We hope that you get something you know, very soon. And this question, I think Bukata should be able to get this one. Now, in kind of question. Let's go. Question number 30.
A child with severe burns undergoes physical therapy to regain mobility. What type of therapy focuses on enhancing the child's ability to perform daily activities and tasks rather?
Your time starts now. So just think of the set of professionals that, if you can, I don't know how best to put this. I don't want to mislead you with my explanation.
It's just voila.
Hey, these two people, if I really, if I really into each other. Oh. That's good. That's good. That's the spirit. That's the spirit. Let's see. Let's see. More to come. I'm waiting to see more people. More. Okay, let's go. Let's go. Let's go. Let's go. Let's go. Drop your answers. It's almost time. 10 seconds to go. Less than that even. We have less than five seconds now, and it's going down. It's going down. And here we are. Well, the answer is do you know why I'm laughing? I am struggling I'm struggling to find out to explain this to Bukata because because I know that he will almost bite me down. What's this? What's this? Because I said you will get it too, and I wish you got it right too. Seriously, he said my answer is wrong. Okay, I want you to prove it, but I understand where you are coming from. See, where is the question again? The question says, who is going to assist the person to perform activities of daily living? That's the key.
Yeah,
So I know maybe some of our hospitals may not have these roles well delineated and well spelled out. But I bet you the proper thing to do is to refer them to the occupational therapist. If you have
yeah,
been to gospel, if you remember when we went for what's it called? Neuropsychiatric posting back then in university, you used to have OT department
yeah,
in psychiatry. Yeah. So OT department will generally be the one teaching them how rehabilitation, taking them through how to cook, how
yeah.
to eat, how to keep their head, all those things that relates to that. That's OT. Physio is not actually related to that. Physio is the branch of medicine that actually deals with restoring, they are more disease focused and restoring health in that
Mm.
direction. When it comes to promoting
Activities
health
of daily living.
and
Mm.
activities of daily living, you leave it to the occupational therapist. Now, what I have said, you can contest it. It's very good. We want it to challenge us. So I'll be putting up a number definitely at the end of this. So stay with us. If you find enough proof that no, what we have said is not right, then show me. But I'll be there too to tackle you, okay? I'll be here to tackle you too. But it's a good thing to contest. It's a this I'm the quiz master. No. It's a learning platform. So you show me proofs. Show me proofs, okay? And we will definitely reconsider whatever we have put up. But definitely when it comes to performing activity of daily living, the occupational therapist is involved in that. And that's what you see in developed countries. Okay, let's go on to the next question. I think somebody got it. Sorry, we've not allocated the answer yet. Did anybody?
Not,
I'm seeing somebody put occupational therapy or gospel.
I'm just worried about the time she put it because it seemed like
Yeah,
when you
I think
actually started saying
yeah.
the answer, that's when she
The
put
answer
it.
was
So
up already. Yeah. So that
I'm
I
not
mean,
really sure.
so let's just go on. Let's go on with the next question is question 31.
All right, a patient weighing 60 kilograms sustains burns affecting 30% of their total body surface area. How much lactated ringer solution should be administered to the patient within the first 8 hours?
Okay, your time starts now. I'm seeing some interesting comments. Not influencer, don't worry, we'll revisit your your issue. To be honest, the time I saw your answer, I noticed that I'd already put the answer up. But again, you can do it. Basically, we've given you an hour and almost 30, sorry, a minute and 30 seconds. So you can do it. You remember cowbell competition? All those boys that used to do
Yeah.
mathematics in 10 seconds. So you can do it. Even but what is most important here is the formula. So if anybody can even tell me how to calculate it, I'm fine. Like we will be fine with that. But just let's see what your answer will be. I know it's
Adene is probably a senior charge nurse somewhere.
this grade is she's a
Just
senior
just saying a
senior
lady
person.
on a guy sef. You sure it's a lady or is a guy?
I'm
Probably a
not
senior charge nurse.
I'm not sure of her status, but let's go. This is the answer.
7,200.
So it's 7,000. So basically, I want you to just be aware of the formula they call Parkland's formula because basically we are involved in administration of medication. Oh, people are putting interesting answers. So. And Bukata, some you are here. Oh. Anyway, I really wish somebody got it, but unfortunately, nobody got it. And like I said,
Yeah.
it it's for us to know about the Parkland's formula. So when you have maybe a doctor had prescribed that you give so amount of fluid, you know, what is most important for you to is to go use that Parkland formula to double check before administering because as much as the doctor is liable for prescribing wrongly, the nurse is liable for administering wrongly. You
Yep.
know, as such, and the same way the pharmacist is liable for. Gospel is laughing. The pharmacist is liable for. What is it now? What is it? What's the word for what the pharmacist do?
Dispensing.
Dispensing wrongly. Thank you. So dispensing wrongly, administering wrongly, and prescribing wrongly. So those three things. Everybody as independent professionals. It's like today is for banter. Everybody's coming for me. Coming for oh God. Bukata, that's very nice. Another big challenge. Just I know it will be difficult for you to. Yes, you are on point. You are close to it. The next 16 hours, you are close to it. But go and check that formula again, the Parkland formula, right? Like I said, we don't want to elongate this because it's not. We don't have all the time to be doing teaching and something. But again, go and check um the what's it called, the Parklands formula, and you appreciate what I just put. If you check it and you say it's supposed to be 3,200, not 7,200, let me know again. I'll give you your money gladly. All right. Okay, let's go to the question. To be honest, you
So,
probably have my contact already or somebody's contact in this team. So you will definitely get through to us. Okay. Let's go to the next question because of time. Are you seeing it, Gospel?
yep. A patient presents with red, swollen, and warm skin, with streaks extending from a wound type. What type of skin infection? What am I reading? A patient presents with red, swollen, and a warm skin with streaks extending from a wound site. What type of skin infection is suspected? Your time starts now.
We're not supposed to give them up to 60 seconds. Yeah.
Yeah, some people have even started answering
Before this thing.
before the question finished.
I was saying, okay, so Bukala is giving me something that looks like VSA. That Okay. It's always zero times 3 times 4. Okay. Okay. I'm not gonna say anything. We'll talk about it maybe at the end of.
Time's up.
Okay, I'm back. Time's up. And the answer is cellulite.
Cellulitis.
Let's see who's
Yeah.
got that.
Elizabeth.
Ah, somebody got it right.
Elizabeth.
Elizabeth. Let me start from okay. Oh, you look start and so Bukata Ishaku again. It's bacteria, but it's particularly cellulitis. Okay,
Yep.
so the answer is I mean the person who got it right is Elizabeth from YouTube. Elizabeth from YouTube. Okay, cellulitis. It's not just a bacterial infection. It's particularly called cellulitis, and that's what we put here as our answer. So that's who is whom we are giving the correct answer. Anyways, let's go to the next question because of time.
All right. A
Because
young woman with a family history of eczema experiences itchy, inflamed patches on her arms and legs. What dermatological condition is she likely experiencing? The time starts now.
a young woman it has a family of eczema, experiences itchy, inflamed patches on their skin. Okay, okay. This question is funny because I know some people will go and be thinking far and they will not even still get it. Most times, the answers to the questions are right in the questions. Just pay attention to the keywords in the question. Pay attention to the keywords and you get the answer straight up. Pay attention to the keywords and you will see the answer. It's not
10
always
seconds left.
highfalutin. Yeah, 5 seconds now. 4, 5, 3, 2, 1, and that's us gone.
Yep.
Okay. Well, this is the
Um,
answer. The answer is eczema. Like I said, pay attention to the question. Pay attention to the
sorry.
question. All right. So the patient has family history of eczema, and the person is also now showing symptoms of eczema. What is he likely to be having? Eczema. You get the point. So it's not long story. I know you people are saying atopic dermatitis, all those things. Well, those are long, long stories. Just because for you to make go far as atopic dermatitis, you might be looking for other key things. But there is already a family history of this one. So, when they make the diagnosis, the essence of this question again is to just help us as nurses appreciate, understand the key things around our job. Okay, our job is we most times we are not doing the actual thing. We are there to provide that check and balance. So if for example, a patient is showing all these things, and maybe the doctor, whoever is clerking, did not pick that this patient has a family history, you know, you will be treating something else, or you'll be looking for what is not lost. But once you can think, oh, family history is there, this and this and this, you can connect the dots. You know what I mean? So it's just helping us to think deep so that in our practice we're able to you know, play around with every information that we get from our patient and make sense of it. That's it. We'll not talk too much. This guy said, what did he say? That what did I've seen somebody make a very funny comment. He said, "Una too wise." Yeah, people are laughing. Well, this one, I think we asked a question like this even last month. But that's just it. Um, let me see. Let me just go to the comments and see what has been happening there. Nobody got it correctly. Nobody got it correct. Your wording suggests what type of infection. Yeah, and what type of infection is it?
No,
What?
he's referring to it's. I think you probably get everything mixed up. He's referring to the other question. So I think we
Yeah.
should just let that be and move ahead.
Okay. That's true. That's okay. The one on cellulitis.
Yeah.
Anyways, okay. Let's go. Oh yeah, now let's go to the next question. Okay, now next question showing just now.
A patient with anorexia, no, a patient with anorexia nervosa presents with dry, flaky skin and poor wound healing. What nutrient deficiency is likely contributing to her compromised skin health? All right, time starts now.
Ah, hmm. This is another very tricky one. I hope I can defend this gospel. I know people like Essie will come and attack me now. I hope I can defend. I hope we can defend this. Oh. Anyway, oh god, oh god, oh god. Who is getting it?
No,
You have less than 10 seconds. Get this one.
apology.
You know that last month I was telling them that a tougher set of questions are coming in the latter part. So those of you that are on this, oh god. Well, let me just show you the answer. Those of you that are on this show, well, you are lucky, kind of. The answer is vitamin C. Again, I'm not going to try to defend it. Just go and look for what deficient anorexia nervosa leads to in terms of uh, the deficiencies that patients like that have, and then relate it to vitamins. Just do your search and do your study. Okay, do your search. Chai, I just underrated it, and it happens. It happens. Oh god! But I think somebody got it to gospel. Somebody put
Yeah, I think Anwoju Oluwatomisin.
vitamin C. She put
Yeah,
vitamin C and
vitamin C
zinc.
and zinc.
You are not sure, but at least you put something that looks like that is actually the answer, but you added an extra one. Anyway, we're going to look away from the extra. That we don't look like bad people. Like this is making us look already. It's making us look like we want to give out this money. You really want to give it out, eh? So don't be mad at us. All right, so that goes to Anwoju Oluwatomisin. Thank you for putting in the correct answer. The correct answer is vitamin C. All right, and we go to the next question.
A child falls off his bike and scrapes his elbow on the pavement. Upon examination, you notice a shallow wound with minimal bleeding. What type of traumatic injury has been has he experienced? And your time starts now.
Why are you laughing with traumatic injury now?
Is it traumatic for me?
Is it traumatic for you? Is it traumatic for me? Oh. Yeah, yeah.
Ah, voila.
Is somebody getting it already? I'm not sure. It looks like it's a tough one. Just maybe. I'm seeing some answers anyway. I'm seeing some very close answers. Okay, and that's us done.
Yep.
Well, the answer is aberration. I
Some
think we have an answer.
some
I
say
think
friction.
friction is the generic thing that led to friction leads to all the kind of injury. So, what kind of injury is it? Is it in particular based on that description? Okay, I think finally Bukata got this first. Finally,
His spelling now
Bukata.
want to give you his spelling now want to show him shaggy.
Oh God, that would be unfair. That would be unfair to him. But I think
Let's
he
just
just managed.
let's
He
just
managed
give it because he now corrected his spelling later
because he
on.
corrected himself later. That must have been a quick typo error. You know what I mean? So, congratulations, Bukata Ishaku, on winning this one. Yes, congratulations, congratulations. I love your tenacity and your commitment. Let's go to the next question, and that is question 36.
A bedridden patient, a bedridden elderly patient develops redness and inflammation in the perineal area. The skin tissue, the skin issue she's experiencing is due to what? A bedridden elderly patient develops redness and inflammation in the perineal area. The skin issue she's experiencing is due to what?
Oh yeah, oh yeah, oh yeah, oh yeah. Let's go, let's go. Let somebody get this one right. Nobody should accuse me anymore because we are not giving you simple questions. Simple questions, very simple one. We are not giving you simple questions. So,
15 seconds more.
and answer is yeah, that's what's done. Okay, so that's the answer up there. What's it?
Oh my god. Incontinence. nobody go nobody came close to it.
Oh, nobody came close. But the question is straightforward that goes for. Am I the one?
No, I
It
don't
says
I don't think actually this question is straightforward because
it's not straightforward, Abby.
it's not it doesn't seem straightforward because a bedridden elderly patient develops redness and inflammation in the perineal area. The skin issue she is experiencing is due to what? Oh,
It's
okay,
due to what she's experiencing in
okay.
school due. So they are talking about the end of everything, which is pressure ulcer, right? But it could be
Yeah,
moisture related pressure ulcer that was developed through moisture building up in that area, and then the skin breaks down.
yeah,
So pressure ulcer is correct, but due to what? Go 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 go.
yeah. That's the point. Like it
Due
had
to
to
what?
be another reading for me to clearly understand the angle the question is coming from because if anyone just read it from like the first view or even second view you probably think is what exactly is the lady experiencing but the question points to what is causing the pressure ulcer. It's obvious that she had the pressure ulcer or a
Mm-hmm.
pressure so
She's
anyhow
having
you
a
want
pressure ulcer already because
yeah
the redness, the inflammation, maybe a grade one,
yeah
like those people in teachability will say. But again, the connecting dots, and I'm good with you know, the purpose of this quiz is critical thinking. So
yeah
not every time you will have the question straightforward.
yeah
In this
exactly
case, they said the patient is bedridden, elderly. So those are clues. For example, like where I work currently, we deal with this kind of patient. So once you have a patient that is not bedridden, elderly patient, you can suspect that their continence is either variable or they are incontinent.
Yeah.
Okay, let me see what the person is saying.
Says
Not
need
just
first urine
body
in
fluid,
body fluid.
fungal, fungus. Okay, you mean fungi can cause skin issues in the perineal area. Yes, it can cause skin issues in the perineal area. But remember that for the
This is
fungi
this is a bedridden elderly patient. Say
bedridden,
shut up.
so they've lost control of a lot of their senses, probably at a state of comatose sef. And remember, for the fungi, coming to the fungi part, for the fungi to be able to thrive, e must have an environment that make them thrive. So we are basically asking you to think critically. So the 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 argument is not whether all elderly patients are incontinent or not. We are already telling you that this one is bedridden. It's specific about the kind of elderly patient. This one is bedridden and has developed redness and inflammation in the perineal area. What happens in the perineal area? You know, so it's just critical thinking, critical thinking, and that's why it is difficult sometimes to be a nurse, because sometimes what you are thinking, sometimes, let me just chip this in. Sometimes you some things pass you by because you did not see it or you did not think
Yeah.
to that, and someone else comes and just picks it so easily, and then the person takes the shine, and you'll be like, it's
Yeah,
as
but
simple
that's
as
that's medicine for you.
that's
Because
medicine for you. Someone else will just
yeah,
come and pick you because of their experience or because of a recent history of the kind of patient they've managed. That's why they say
yeah.
experience cannot be bought anywhere. So pay attention to the keywords, and let's imbibe that culture of critical thinking. Well, we are critical thinkers already, because for us to be a nurse sef, it no be small work. So good of you, kudos to all of you, and I'm happy that you are challenging. Excuse me, I'm happy you all are challenging every answer we put on. That's it. So again, like I say, if you find any one of them uncomfortable, do your research and come up with proofs, evidence, and
Yeah.
let's ruminate and deliberate further on it. But not just now. We are going to be taking too much time if you are doing that now. So let's go to the next question. I think that nobody got it right.
Nobody got it.
Nobody got it right. So let's skip that. Let's go to the next question quickly.
A patient undergoing chemotherapy notices thinning of her skin and increase of susceptibility to bruising. What is the most likely cause? Your time starts now.
Oh yeah, this one is straightforward now, because
I've been Coco.
let's
Yeah.
hope somebody gets it right. Where is Ishaku and where is Ese? Where is Oluwatomisin? Where is Oyedoku Esther? Where is who again has been Blossom? Where are you?
Blossom
Blossom.
just won the one that she won and she ran away.
And she ran away. It's like she has gotten her data back, her data money back. She just got the data money and she left. Uh, no, no, don't go, don't go, don't go. Remember, you will not be able to know how to claim your price if you don't stay to the end. So stay
And
to the
then we
end.
are waiting for your answer.
Ene and
Say
Ishaku.
big stuff.
The deep stuff, the stuffy people of tonight. So the answer is simple, oh my guy. What
Immunosuppression, you.
I think it's clear now, because when you have a patient with on chemotherapy, cancer
Yeah,
generally, they are immunosuppressed. So let's see if we
yeah.
have anybody who got it. Somebody said
No,
side
no,
effects.
no. Nope,
Hmm.
nope.
No. I know one common side effect of chemotherapy can be alopecia. They lose their hair.
Yep.
They also vomit oftentimes. I mean, there are other fewer side effects, but when it comes to, yeah, immune suppression will make them susceptible to infection. Yes, Oh, you don't know. You say not bruising. Another interesting conversation. It is. I'm trying to remember a scenario to use to paint it. But if if you if you ever nursed if you ever nursed cancer patients, especially those of them that are even light skinned, or maybe not even light skinned, usually they usually have uh, this kind of thing they were where blood just, I'm trying to remember the name, under their skin. Yeah, something like erythema, ecchymosis, all of those things. You get. So the question cannot be straightforward. That's what you have not got it right. It cannot be straightforward. If it is straightforward, then you are not required to think. If it is straightforward, then you are looking for straightforward questions, straightforward answers. No, there is no straight. Do you know that in medicine there's nothing straightforward? That's why three, four patients can be having similar symptoms, but you will have to do a lot of thinking and investigations here and there to come up with diagnosis for different people, and in fact management plan for different people. So straightforward is a clause I'm careful with using in this quiz. However, the question is thinning of skin, increased susceptibility to bruising, all those things is basically because the immunity is getting suppressed. Anyway, like I said, you have the right to challenge every answer, but come up with proofs. Okay, let's go to the next question. I think nobody got the answer. Nobody
Yeah,
got
and
it.
should that be our last question for tonight? Because already
17, 18. Let's should we try and move it to 40?
you say even your uncle is not happy. He's
He's
not
not happy.
happy.
It's not my fault now. Nobody gets it. We are not happy
Maybe your
because
uncle is
we
not
want the money
happy.
to go out for, you know. I think I mentioned it that the questions at the end part, they are difficult. They are more difficult, and you know it has to challenge our thinking. Just does it
I think
basically.
I think the next question should be the last question.
Okay, I will stop at 38.
Yeah, so that people can breathe in and breathe out today.
Oh yeah, let's go, let's go, let's go.
Oh my
Oh my
god.
god. So
What's the last question? It says a malnourished patient presents with pale, thin skin that bruises easily. What nutrients what nutrient deficiency is likely contributing to his compromised skin health? Someone will just put vitamin C. Oh my god.
but you know this one again, it's clear. If somebody is arguing this one again, I will,
Mhm.
I know. Okay, I think I'm not going to worry again because somebody got it. Because somebody is on the pathway so quick.
Mhm.
So, because if you argue this, then you are not paying attention to the keywords. Again, I will tell you to always pay attention to the keywords.
19 sector, 18 left.
Okay,
5.
I think we are done, and that's it.
Yep. Propane. Congratulations, Bukata.
Okay, Bukata got it. Finally, you got your data money back. You got your data money back, even if it is 1 gig. Congratulations, congratulations.
Oh
So
my god.
we are going to hang it here. We are going to hang it here for today. All of you that have joined us, a lot of you joined. I'm so happy. I'm so happy to have you all here. Thank you, Elizabeth, Bukata. Elizabeth, are you crying or laughing? I don't know. I don't know. This emoji, don't cry, don't cry. you have another you have another opportunity next month. Well,
Next
gospel, I'm
month.
thinking of something, sir. We are for those people that have been winning quite well. Maybe we'll
Yeah.
just bring them on the studio and do a one-on-one section. What about that? And
All right.
we,
Like a quiz night for them, I guess.
yes, so it will not be open to everybody in that particular edition. It will just be
Okay.
us asking that individual questions. If you think you like the idea, put it in the comment section. Yes, no, yes, no. You know.
Is it that particular individual or the group of individuals that have um
Anyway, we can
won?
make it a group thing too. We can make it like that too. Well, we will think through on that. But what came to my mind is doing something like Who Wants to Be a Millionaire, remember? Where we'll
Yeah.
just be sitting, somebody will be on the hot seat and we'll so maybe say 10 questions for the person, and maybe
All
another
right.
person will come up on the stage to do that again. And
All right.
so people like
That's fine.
Ishaku, you will have all the time, and people like Adene, you will have all the time, and then we even
No,
give you the liberty of.
Adene is a senior charge nurse
So we'll not give
in
her, we will not,
one of
it's
this
not part
country.
of
Are
the.
you not seeing that he's giving away he's giving away his he's winning money to Ishaku. That's
Oh
very
God.
nice of you. Thank you. Thank you, Essay. He's giving away his the prizes that he won to Ishaku.
Oh, are you serious? He's giving it.
Yes.
Hey, this levels is deep. Oh.
I tell you, say we are going to be meeting him. We are going to be meeting him for support and
It's true. You need to be sponsoring us. Oh yeah, let's be calling for sponsorship.
and then
Let's
let's say
start
if you
calling
can
people.
hear us,
If you can hear us,
we
we are
are
looking
reaching
for
out to
sponsor.
you for sponsorship.
Okay now. So
We are reaching out
if you have
for
won anything
sponsorship.
today, please chat that number up. So chat the number up and let's know you. Let's meet you. Again, there is a WhatsApp channel www.bit.ly/forward/nosd, and it will take you to the channel directly. Okay, it will take you directly to the channel. So just you join that channel and you can get a lot of instant updates on all we do, even the new stuff we're trying to plan. You can know more about it. Okay. Um,
Mhm.
don't forget
Thank you
to.
very much, Josiah Dare. We see you.
Oh, Josiah. Well done. Thank you, Josiah.
Thank
Uh,
you for joining.
Gospel, don't you think we need to know who this person is? This Adene person. This Adene person. Don't you think we need to know the
I
person?
tell you, say, don't need to do your research. I've done my research. You can hold me to that.
Oh, really? Okay. Oh. I'm going to post it in the comment section. No, our senior charge. Our
He's
senior
a
charge.
senior charge nurse.
Ah,
He's a
oh,
senior
God.
charge nurse. If he's not a senior charge nurse, he's probably a senior nurse in the management team.
He's not a student. You have
He's
come
not
to
a
take the shine
student
of
at
our.
all.
Anyways, I still celebrate my wonderful student colleagues. My what's her name now? Nurse influencer. I don't know if
Yeah,
Elizabeth is a student. All of those young ladies that have been participating for a while. Congratulations to you guys. I hope you guys got one or two questions correct. Oyedokun Esther too, you have been participating. I think I've been seeing you. And would
yeah,
you? Congratulations and thank you for joining us. And remember, to every of the question we feel the answer was not correct or whatever, don't forget to, you know, look it up online, search, read textbooks, and just search and come with evidence, you know, and let's know if you have a stronger opinion or a stronger point. Definitely, we are good to go. We would always come back and revisit those questions and talk about them, clarify it. Okay. Thank you guys. Thank you guys. Please don't forget to like. Don't forget to subscribe. That one is very important. Abina, what do you think?
yeah. That's very necessary.
Yeah. Yeah, Blossom. Thank you also for joining. So that's very important, guys. But don't forget to um, like, comment, subscribe, follow, invite your friends, and I think we should be signing out just now. We'll see you in the next episode.
Yep.
Just for any final
See
word.
you. See you next month. Thank you very much to everyone that joined us today, and thank you for the support. Thank you for the banter. Bukata, you're still going on.
No, don't put it here because this one can then this place
Yeah,
can clear up.
it's
Let's have
going
the
to get.
discussion in the chat in the main chat
Yeah,
after this live stream is over. Okay, you can
I
put it
think
in the
it.
main chat
I think
when the
you
live
should
stream.
put out the link again for the chat so that everyone
Yeah,
sees
I
how.
even mean that the like once this live stream is over, you can then stop chatting live and then you can put it in the comments. So in
Oh,
that comment section, put
okay,
it there and we'll
okay,
see
that's
it.
fine.
But I think he's on Facebook too, so I can always revisit it and I will drop a comprehensive response.
Oh,
But
okay.
again, just try and put all your answers together and post it. And I'm going to trace it on Facebook. All right. But thank you for really engaging. Thank you for engaging so well. So again, this is for you to join the the WhatsApp channel. So you can join and share with every other person to join. Just bit.ly/NOSD and you will get to join the channel. And we can always interact better on that platform. Okay, okay. I think it's a good time to say bye bye.
Yeah. Bye.
Bye bye, everybody. Bye.